Hello everyone, my name is Rushmilahi and I'm a final year student at Beacon House National University, Lahore. I'm very excited to present this paper that me and my teammates Tareen Fatima and Sayyida Fazara have worked on. We have worked on identifying gaps in healthcare setups, specifically in South Asia. We have used a data-driven approach to assess and identify gaps in healthcare setup in South Asia. The main motivation behind this paper is that according to UN Sustainable Development Goals Report 2023, around 381 million people, that is 4.9% of the world's population, does not have access to basic healthcare. So measuring the current accessibility of healthcare facilities is essential for improving healthcare standards and achieving universal health coverage. Since we'll be using 3 publicly and freely available datasets, we are saying that we are using a data-driven surveillance approach for a scalable solution. By using a scalable solution, we can identify which areas are at most risk of inequitable access, which unattended areas have healthcare disparities, and how they can be overcome in ways tailored to the specific challenges faced by individual communities. So the overall concept is that we are using 3 publicly and freely available datasets. These datasets are first one is from Global Accessibility Map, which is developed using the OSM Road Network. Second one is population density, which is using, population density using NASA gridded population of world version 4. Lastly, we have nighttime light intensity from VIIRS satellite. First of all, we'll be filtering out locations where the travel time to the nearest health facility is greater than 30 minutes. Secondly, we'll be filtering out locations where the population density is greater than 50 persons per kilometer square. Lastly, we have nighttime light intensity, for which we'll be setting a threshold value, since we want to identify areas where unattended areas basically. So we'll be using a threshold value, which we'll be discussing later in the result slides. Using the intersection of these 3 results, we'll be finding out the regional need score. And using that need score, we'll be identifying top 10 areas, which are in most need of healthcare facilities, which have the greatest health risk.
As you can see, the first data set is Global Accessibility Map. The data was publicly and freely available. We have shown this for the whole world, that the darker areas have less time to the nearest healthcare facilities and the brighter areas have more time to the nearest healthcare facility. Similarly, this is the population density map, and from NASA. Here you can see the dark areas have low population as compared to the bright areas. For example, the region surrounding the South Asian patch has more population than the other area. And this is the nighttime light intensity map. Data from VIIRS satellite. Here you can see areas have here you can see some areas have more nighttime light intensity as compared to the light areas. So based on these 3 data sets, we have found the regional need high score. We can see the black areas have more high score. They have more health disparities as compared to the other areas. We filter these 2 conditions, specifically locations where drive time is greater than 30 minutes and population density is greater than 50% per 1 square kilometer. Based on intersection of these 2 data sets, we found out that the regional need score area, which have high score, have more health disparities. So based on nighttime light intensity map, we have found out the health disparities, and we found out that unattended areas which are at more risk of health disparities.
For example, we categorize the areas based on nighttime light intensity because we want to find out the unattended areas and we wanted to focus on those specific areas. So here you can see we found out areas in South Asia where nighttime light intensity is between 0 and 10. They are the unattended areas, and similarly, we change this threshold to 10 and 20. As you can see, there are some areas where nighttime light intensity is medium, and nighttime light intensity in these areas, which are elite areas of South Asian region, is is between 20 and 30. So based on the nighttime light intensity and the regional need score, we found out that where the nighttime light intensity is between 0 and 10, which are very poor areas, as you can see, the unattended areas or rural areas, we have actually more drive time to the nearest hospital, and we set the threshold to greater than 30 minutes. So drive time to the nearest hospital or clinic is greater than 30 minutes in all these blue areas. And there we have nighttime light between 10 and 20. Here you can see the health disparities are less as compared to the left figure. And similarly, in elite areas where nighttime light intensity is high, we have less time to the nearest hospital or clinic. So we can say the left figure is all the areas where we can have, these are the underserved remote areas where we have more drive time to the nearest hospital or clinic. To summarize our presentation, we actually use freely publicly available datasets. We identify healthcare disparities, and we identify from the South Asia region the high need score areas, which are underserved areas, and we also provide policy framework in our paper for prioritizing the resource allocation to regions with greatest healthcare needs. And this is scalable and sustainable solution which we can support universal healthcare coverage, and this encourages cooperation among South Asian countries to address shared healthcare challenges and improve healthcare outcomes. So that's all from our side. Thank you for your time, and if you have any questions, we are available.